Hi, I'm Erin. In order to prepare for the OII AQ inspection this January, we've created this short video to review the elements of working within a Dyad model. At the MUHC, when LPNs were integrated into nursing teams on some inpatient units, a Dyad model was chosen to help nurses and LPNs work together more efficiently.
Why was that model chosen?
It is based on the work of Kalish and colleagues on missed care. Let's talk about what missed care is and the factors that contribute to it. Missed care is also known as unfinished nursing care or care left undone. It refers to needed care that is delayed, partially completed, or not completed at all. A nurse faced with restricted resources will use the nursing process to determine clinical priorities. This sets the stage for nursing care to be delayed or omitted. Factors contributing to missed care include lack of staffing resources, lack of material resources, lack of teamwork, and lack of communication. Missed care is primarily a problem of time, pressure, and competing demands. Adequate nurse staffing is needed to prevent missed care. Cultivating cross-monitoring and cooperative problem-solving may decrease the frequency of missed care. This is where the Dyad model comes in. Let's look at the elements of a well-functioning nurse LPN Dyad. A well-functioning nurse LPN Dyad requires three elements: collaboration, delegation, and communication. Over the next few minutes, we will look at each of these elements. Collaboration is founded on common goals for the patient. It requires open and continuous dialogue and a clear understanding of roles and responsibilities.
Okay, Mrs. Jones, I will ask the nurse to come and address your wound. It looks a little red.
In the nurse LPN Dyad model, the team works together to care for their assigned patients. The LPN requires a nurse of reference on the unit at all times. The LPN cannot be in a dyad with the CPN or be in charge of the unit. Each professional is responsible to document the care they provide. The next element, delegation, is about working with people to accomplish more than one person can do alone. Delegation often brings up questions about accountability. Questions like, am I giving up control when I am accountable? Am I going to be blamed if something goes wrong? Am I responsible for everything? The nurse is responsible for overall care and appropriate delegation. The LPN works independently once a plan is established. The LPN is responsible to report to the nurse. The nurse is responsible to follow up on specific key issues identified as concerns. Let's look at a couple of scenarios about delegation and accountability. The nurse and the LPN scan the assignment quickly. It's going to be a busy day. The nurse reminds the LPN that Mrs. G is an MPO for a test. The nurse enters the room later to find Mrs. G eating lunch. Who is accountable? What do you do now?
The nurse is accountable for adjusting the patient's care plan in light of this error.
And following up with the LPN and giving feedback. In case of appropriate delegation, the communication may not have been clear.
Why didn't you discontinue Mr. T's heparin drip?
I'm sorry, but as an LPN, I'm not permitted to discontinue a heparin. The nurse asked me to do something I'm not permitted to do. Perhaps I should have said so earlier.
A case of an inappropriate delegation.
You are absolutely right. I am so sorry.
It's okay.
Let's look at the 5 rights of delegation. The right task, under the right circumstances, to the right person, with the right communication, under the right supervision and evaluation. Responsibilities when delegating. Making the decision to delegate, assessing the patient's needs and planning the desired outcome, giving clear directions and obtaining acceptance, following up and giving feedback. Responsibilities when receiving the delegation. Accepting the delegation, performing the task, following up with the person who delegated if there are concerns. Let's look at communication within the nurse LPN Dyad. Did you know that communication lapses were found to be the root cause in 65% of sentinel events? This is why good communication is critical for patient safety. In order for communication to be effective, you need to be clear, concise, correct, complete. You need to confirm, and you need to come back with your understanding of the exchange. Let's look at an example of unclear or poor communication.
Sarah, is the new post-op in room 103 here? I don't know. Is he here? I thought you were going to assess him.
So what happened there?
Sarah didn't accept the delegated task and I was not playing what I was asking.
Here's a roadmap. The nurse and LPN Dyad should review their assignment and do their initial visit together. The Dyad can then set nurse and LPN priorities. Frequent communication should occur throughout the day to assess progress and readjust the plan as needed. At the end of the shift, the LPN should give her report to the nurse. The nurse then gives a handover to the next shift.
Why don't we just divide the assignment? Wouldn't that be more efficient?
Each professional has their own scope of practice. The nurse is responsible to evaluate all the patients under their care. Let's recap. A well-functioning nurse LPN Dyad requires collaboration, delegation, and communication. Thank you so much for taking time to view this video.